Hi, everyone. Welcome back to another episode of the Slimming Surgeon podcast. I'm your host, Dr. Kandace Kichler. Today, I have a beautiful colleague of mine on the podcast as a guest, Dr. Tiffany Di Pietro. She is a graduate magna cum laude with a bachelor. Oh my God, we got to start over. I never start over, but that was just horrible. Okay. Hi, everyone. Welcome back to another episode of the Slimming Surgeon podcast. I am your host, Dr. Kandace Kichler. Today, my guest is a beautiful colleague of mine, Dr. Tiffany Di Pietro. She graduated magna cum laude with a Bachelor of Science degree in psychobiology from FAU at 19 years old, like baby genius. She then went on to become the youngest graduate from the College of Osteopathic Medicine at Nova in Fort Lauderdale. She's triple board certified. So she's board certified in cardiology, internal medicine, and nuclear cardiology. Like, I didn't even know there was a board for that. So she's literally amazing. Her true passion lies in helping people to achieve their health goals in a preventative nature. And I'm all about that. So we definitely click on so many topics. She enjoys educating the public about health, nutrition, and disease prevention. And if you don't already follow her on Instagram, you will after this, because not only is she so great at educating us, but she's super entertaining as well. So in addition to working and being amazing, she is an assistant clinical professor of 3 different medical schools. So she teaches cardiology in the classroom. She has a private teaching service at Broward Health Medical Center, a level 1 trauma center, and she serves as a medical advisor at a law firm in Fort Lauderdale. So she is super, super busy. She's a past president for the American Heart Association of South Florida. And she was also appointed to the board of osteopathic medicine by Governor Ron DeSantis in June of 2021. And she now serves as chair of the board. So because of all of her accolades, she's often on TV as well with Fox News, Fox Business. She serves as a medical expert on various topics, but she enjoys educating the patients and the public about how to prevent cardiovascular disease. We're going to get into all of that today. So with no further ado, thank you, Tiffany, for coming on.
Thanks for inviting me.
So we met in the middle today. Tiffany is a little bit south of where I practice. It's horribly raining, so we look a little rough today compared to how we normally look, which is 5 stars. But nonetheless, we're here to share all the details with you. I just want to start with why cardiology? Because when I was in medical school, that was like the last thing I wanted to learn about. Oh yeah. It was like EKG, Chinese. I like it, interesting because you're a surgeon. So you like anatomy and it's like, this is this, and that's how it is. And end of story. I'm the exact opposite. I like how things work, why they work. I'm not a fan of having to memorize various body parts because some random dude named it after themselves. Yeah, right. That is annoying. I'm not going to lie. The other day, my nurse wrote the tale of Spence. And I was like, why? Who's Spence?
Because Spence has an ego and Spence needed to name something after himself. So, the nice thing about cardiology, truthfully, from a kind of egotistical standpoint, is when I say jump, people say how high, because it's like, you're the cardiologist, you know everything, they come to you, well, I have a UTI. I didn't want to start anything without asking you first, so it makes my job a little easy that people just kind of listen to me when I speak, which is nice as a doctor, because, a lot of times people don't listen and they're non-compliant. And there's really not a lot of female cardiologists. So I kind of was able to pave my own path pretty quickly and kind of establish myself because women, as you know, tend to want to see female doctors. Mm-hmm. And then what happens is then they send their husbands to come see me, and I've kind of built a practice off of just being a woman. So yeah.
I would agree. I have a similar experience. It's just that listening component that we have that a lot of our male counterparts don't necessarily have, and the empathy and the OCD-ness that we often possess that keeps us kind of in the top.
Well, you've seen all of the studies recently that show over time and time again. And again, it's not a bash to my male colleagues, but female physicians statistically have better outcomes than male physicians. And I think that's why.
Yeah.
I think it's being detail oriented and, really caring to the point where it's almost detrimental to your own health.
Yeah.
You care so 100%. Much about the patient. So, and then there was a surgical article that came out. There's better surgical outcomes of female surgeons.
Exactly.
So
Yeah. So call us.
Yeah.
So tell us about your practice, because it's super unique. I feel like you are one of the first people that I knew in the medical field, at least in this area, who kind of went off on their own and did the concierge aspect of cardiology specifically.
Yeah, I have a kind of a bizarre practice. So I'm an internist also by training. So I do concierge internal medicine still. I have a teaching practice at the hospital, like you alluded to, and that's mostly internal medicine. I teach the internal medicine residents. And then cardiology, I have concierge cardiology, a facet, not a huge part of my practice, and I do regular like fee-for-service cardiology. But the majority of my practice from a cardiovascular standpoint is prevention. I do a lot of cardiovascular prevention. I have a lot, the average age of a patient for most cardiologists is probably late 60s, mid to late 60s. Mine's probably late 40s. Okay. So I do a lot of cardiovascular prevention. I had a guy today, I have high cholesterol. I just want to make sure everything's fine. Scan me from head to toe if you have to. A lot of my patients don't want to be pat on the back and say you're fine. They want you to really dig down and find if there's any problems early on, which is where my passion really lies in cardiology.
I love that. So what are some of the tips and tricks that you tell people? I mean, they're not tips and tricks. They're like real life advice. Like, what are some preventative strategies that anyone can and should be doing?
Number one, believe it or not, is knowing your family history.
Okay.
Big deal. Big deal. So if if you're adopted and you have no idea, that's different, right? But you should know what problems your immediate family members at a minimum have had. Because if your mom or dad dropped dead of a heart attack when they were 40, that is a major, major risk factor. And it's a non-modifiable risk factor. You can't control that mom or dad died, right? You can kind of control your blood pressure, you can control your sugar, but these non-modifiable risk factors are extraordinarily important because it kind of hones the doctor into, hey, your cholesterol is a little high, but you've got significant risk factors in your family. A little high for you might really be a lot high.
Exactly.
Right? So family history is a big, big, big one. Something that I know you talk about a lot as well, and there's a lot of research behind this. Really, people just need to be smaller.
Yeah.
Like their bodies just need to be smaller.
Yeah.
And you would be very hard pressed to find any science that doesn't say that.
Yeah.
So
But you can find a Cosmo article that says you should be larger.
So I just did a talk at a national conference, and I spoke about this, and I said, listen, I'm not here to tell you whether or not you think you're beautiful. That's not what I'm here for. My job is to tell you that you're healthy or not healthy, and it is not healthy to be obese. Period. End of story. So that's a big thing, and how you achieve that. There's a multitude of different ways, but when research articles say if you are so heavy and you can't do it on your own that you should go under a knife and get surgery. That's a huge statement for something in the medical community, because we usually don't tell people to get cut on.
Right.
That's usually a last resort for us. Yes.
Emergency only type situation.
Correct.
Right.
So, how we achieve that, I kind of do some weight loss too, and we go through all that, and sometimes I prescribe medicines, but weight's a big one. And then third, interestingly, today I was on the phone with a patient as well, a concierge patient, and I think I'm people's therapist half the time, which I'm okay with because, they're paying me and I'm their doctor and I'm happy to talk to you about whatever you want to talk about. But mental health, it's a big deal, very stressed out, blood pressure goes up, blood sugar goes up, cortisol levels go up. So I talk a lot about meditation in my practice, decompressing, stepping away, going outside, having a breather. I have to do it. Today was one of those days. Today was a SHIT show. It was a disaster today in the office, and I had to stand up and walk outside and just take a few breaths because it was like everything was on fire. So I talk a lot about mental health, and I think we kind of leave that out in medicine a lot because it's a big part of the puzzle. You can be perfectly physically healthy, but if your mind's kind of on a whole different track, it causes a lot of problems.
Gotcha. Yeah. What about exercise? I thought for sure you're going to be like, you need to exercise. You need to
I think that's part of being, being on the thinner side, right? Yeah. So, most people that are on the smaller side are couch potatoes, right? So I say thin because it kind of encompasses eating well, exercising, being active, but then again, I think everyone knows that. They just might ignore it.
Yeah.
But everyone in their heart of hearts knows that they should be active and, have a healthy diet that doesn't have a lot of animal products in it, that we're not eating red meat every single day, and we're not eating hamburgers and hot dogs and potato chips, right? If you don't know that by now, you should go back from the rock that you crawled out from under, because we know that by now. It's not easy to do, but,
Sure.
and I'm not a vegan. I eat cheese and meat, but it's not the substance of my diet. Right. So yeah, I mean, I think that's part of just being on the smaller body habitus side.
Gotcha. So most of your patients, you're teaching this prevention, you're going through these like preventative measures with them. What do you tell someone who, let's say it's like the wife or something of a male patient that you're seeing, and she's super, super skinny, but she doesn't do any of those things right? Like skinny fat. Is that a thing?
Yeah,
is
that's
that
a
something
thing.
that you worry about?
Yes, it is. And again, I think that's when you circle back to what someone's genetics kind of looks like, right? Would I rather someone be skinny fat than fat? Yes.
Yeah.
Because at the end of the day, weight is weight. But exercising and having cardiovascular health and having that stamina and allowing your heart rate to get up and then drop and then get up and then drop, that's what's keeping your heart strong. Your heart's a muscle, just like any other muscle in your body. If you don't work it, it doesn't work very well in the long run.
Right.
So yeah, I talk a lot about that. I do.
Gotcha. So, how do you feel? Like, do you get a lot of negative feedback being like a pretty female physician from patients or colleagues, both? Like, what's the landscape like now for you? Like when I was in the hospital, I still felt a lot of this, but it got better the longer I was there and around the same amount of people. As people get to know you, they know your work ethic and they know how good you are or not good you are. And now that I'm mostly patient focused in the office, it's not as big of a deal. But how is it with you?
It's not that bad. And I don't know if it's just this aura.
Yeah.
I feel like you walk in and like you like command respect or you don't command respect. Mm-hmm. My residents tell me that I have a what's the word I'm looking for? It's like I'm notorious for just being the person not to mess with. So I guess that's a good thing.
Yeah.
I guess it depends on who you ask. I mean, everyone has, not everyone's going to like you.
Yeah.
But I haven't had a problem with it. I think if anything, I think being a female cardiologist kind of sets me apart from my male colleagues. And, but I don't consider any of them competition. I have a completely weird, different practice that doesn't really impede on their ability to make money because, in medicine, that's what it all boils down to. Who's stealing my patients?
Yes.
Who's taking my money? And I'm not doing any of that. If anything, I'm usually giving things away to people because I don't want to go to the hospital as much anymore. So,
exactly.
But no, and I think my patients are happy to have someone that, I wear stuff like this to work. I wear jeans or slides or.
Like you're a real human.
Yeah, I'm a human. When I walk in the room, I jump up on the exam table myself because they're usually sitting in the chair. I sit, cross-legged and what's going on? Like talk to me. And I think they appreciate that because they're not kind of like herds of cattle just rushing in and rushing out of the office and en masse. So.
Right. How long is a typical visit with you?
New patients for Concierge are 40 minutes to an hour. Mm-hmm. So we book an hour. Sometimes they're in the room 40 minutes, but then I use the extra time to get the notes done. All patients, Concierge follow-ups are 40 minutes. No patient is booked less than 20 minutes.
Yeah.
So even the cardiology patients have 20-minute appointment times.
So you still do some patients like through their traditional insurance.
Yep.
And do your concierge patients, do you accept their insurance and then just kind of have like a membership on top of that? Like, yep. How does it work? Because people that are listening are going to want to know these details. Like, how can I get a concierge cardiologist or internal medicine physician? And what are the benefits to that?
So if I'm contracted with their insurance already, then we bill their insurance. I have to legally. If I'm not and I only take 3 insurances plus Medicare. If I'm not contracted through their insurance, then their concierge fee, which is $5,000 a year, covers anything that's done in my office that I do myself. Okay. So we draw blood, we do ultrasounds, I do stress tests. So all of that's kind of covered under that fee. But like, let's say you need an abdominal ultrasound. Okay. I have to pay my tech to do that, but it's like $50. It's not a lot of money. So that's usually the only extra charge people have. But they have my cell phone number, which is why you see my phone's out on the table. So they have my cell phone number. They can call me, text me 24/7 about whatever they need. And today was one of those days where I feel like all 275 patients were texting me today.
Yeah.
So, but it's wonderful. I know all of these people personally. I know, they text me, I can see their face. I know exactly who they are. I know what their problems are. I know my boy who'd cry wolf patients that it can probably wait an hour before I text them back. So,
right.
It's a wonderful thing. And it's nice to be a primary care doctor and cardiologist that I know them as individuals. It's not just a number and a chart.
Right. Yeah. So do you have a cap? Like,
that's the golden question. If you asked me a year ago, I would have told you 250.
Okay.
And then I got to 250, and the patients that had been signing up around that time were young, very healthy people that really didn't need a lot of hand-holding. They just wanted a doctor kind of at their beck and call when they wanted one, because they were lawyers and accountants and other doctors, and they don't want to wait in a waiting room. And when they get a sinusitis, they want to text me and have something called in. They don't want to wait. So I feel like I'm getting there. I'm not quite there, but I'm getting there. I'm getting there.
Do you have any advanced practitioners in your office, or is it just you? Do you have a nurse? Like, what's the landscape like?
It's just me and my office manager / medical assistant / runs my life.
Yeah.
So it's me and one girl. And then I do have another employee who works from home that just helps me and helps us really with answering telephone calls, insurance verifications, things that I don't need someone physically in the office for.
Yeah.
Which helps a lot with personalities, because it's only me and, someone that I love very dearly. That's my office manager. And, when I'm there, she's there. If I'm not there, I don't make her have to be there.
Sure.
Our phones are internet based, so she can answer her phone from anywhere in the world. And so it's a nice little system that we have going on. Yeah.
Gotcha. Are there any other physicians like you in the area? I don't think there are, like doing exactly what you're doing or similar.
No, there are quite a few other concierge doctors. They're all primary care. And I think that's if I'm going to pat myself on the back a little bit, it's nice because ultimately most people have some form of a cardiovascular problem at some point in their life. So they're kind of getting a twofer for
or
lack
they
of a
need
better
like
word.
a clearance for some procedure, endoscopy, whatever it may be, their breast implants.
Right.
Yeah,
exactly. So there are a lot of kind of, and MDVIP is a big company that does a lot of concierge medicine, but it's still kind of commercialized. There's like this still a kind of like a centralized answering system. And so no, I think, I can think off the top of my head, there's maybe 2 other people in the area that really kind of do what I do, and they're not subspecialist also.
right. So obviously you probably taught yourself all of this, like the business side of it, because we learn none of this in medical school or residency. Was that hard for you? Did you have to hire someone to help you understand like how to do the billing and how to do the coding and all of the things?
Nope, I Googled it like any other good patient. No, I did. I Googled it. It was kind of trial and error. Luckily for what I do, unlike surgery, for instance, there's not that many codes that I could kind of tell you the codes off the top of my head and kind of know what they reimburse, versus surgery where it's like you're coding for each literal and individual thing that you're doing. So the coding and billing is not too difficult. But with that being said, these people are paying me $5,000 a year. I'm not nickel and diming them.
Yeah.
Right. So if the insurance comes back and they didn't pay, whatever, when then they're in there next time, we'll ask them to pay then. If they don't, I don't care. I don't make a big deal about it. And that's the upside to this. Like there's no nickel and diming with the patients, which is nice.
So what would you tell a student or resident who is in training that wants to kind of head in the path that you are in this, independent practice, which is so different these days? I feel like everyone's employed. Everyone's working for some corporation. Like, what advice would you give them?
I talk to my residents about this a lot, and I get students sometimes that, and I'm going to veer off for a second. That's not about concierge, but I get students sometimes like, oh, I want to be a surgeon. I'm like, don't do that. Like, you don't have the personality for that. Like, it's almost like kids, I call them my kids, right?
Yeah.
They're not even intuitive enough to see themselves and what they can handle and can't handle. I'm like, you don't even like to talk to people. How are you going to be a surgeon?
Yeah.
So I tell them, I'm like, listen, you've got to really step back, analyze who you are as a human being. If you like to talk to people, you don't like to talk to people. Do you like charting? Do you not like charting? Do you mind being at the hospital, working late hours, being on call? Do you not? You got to figure that out before you figure out what medicine you're going to do, right? Because if I want to be an OBGYN, oh my God, I can't wait. I want to deliver babies. Oh, I'm so excited. And I also want to have my own family and be home by 5 o'clock. It's not going to work.
Yeah.
It doesn't work. So my advice to everyone is kind of really sit down and do the pros and cons of everything. Because for instance, I really wanted to do ER at first. I liked the 7 on, 7 off. I come home, I don't have to deal with it anymore. But I also realized there's kind of a cap on the finances of that. Unless I go open my own ER company or urgent care, you're kind of capped out as an ER doctor. You can't really kind of make your own money, so to say.
Unless you work a lot more.
Yeah, which is then almost working, 6 days a week, 12-hour shifts, which isn't feasible. So kind of said, maybe that's not the direction I want to go. And same thing happened in cardiology. I was very good in the cath lab. I have oddly talented hands. Like I probably should have done surgery, and I just didn't want to be on call. I didn't want to be that person that was miserable waking up at 2 a.m. I don't have that kind of ego. I don't need to tell someone, oh my God, I like totally saved your life tonight. Like, I don't need to do that. I want to sleep.
Right.
I don't need that in my life. Some people do. So my advice really is kind of figure out what you're good at, what you're not good at, and kind of dissect it from there, because what I do with Concierge is not for the faint of heart. I mean, there are questions that I get asked that I'm in my head, I'm thinking this totally could have waited until tomorrow at 8 a.m.
Yeah,
you know, like, but
sure.
you have to swallow it and say, oh my God, not a problem. Whatever you need, you know? And I turn to my husband like, you know?
Yeah.
And he's a lawyer, so he gets it. But I think that's the biggest thing is people, not really kind of recognizing not just what they like career-wise, but what they are expecting out of their personal life as well.
Right. And I feel like there's a big discrepancy in what they think the career is going to require and what it actually requires. So like, for example, you say, you know, maybe you meet a student or a resident or someone who wants to go into some type of surgical subspecialty or a surgical field or, you know, a procedural specialty. And they have no idea like that they're going to need to take call, that they're going to need to work really, really, really long hours and no one cares. Like you don't get to just say no and like go home. Like no one's going to give you a gold star. Like it's your own pity party if it doesn't work out.
It's so funny. You're right. It is your own pity party. When I was in fellowship, they called me in the middle of the night to go put in a pacemaker. I got to the hospital. And the whole reason that the rhythm was messed up is just because the electrolytes were wrong. So I got out of bed at 2:00 in the morning, went to the hospital, gowned up to look at the labs and say, you don't need me here. Turned around and went back home. And nobody cares. Nobody cares. My attendant, good for you. Congratulations. I don't know what to tell you. Here's your gold star.
Yeah, exactly.
Yeah, it's a tough, you know, and I think this kind of like new generation that are graduating, you know, they kind of just want to work and go home. But at the same time, they have $350,000 of student loans and they want to go home, work 9 to 5, not work any weekends or holidays and make $500,000 a year. It doesn't exist in South Florida. The job doesn't exist.
Exactly. Well, I feel like we have the same brain right now because I just kind of switched over and got out of the hospital and have been in this practice for a good 2 years where I am no longer interacting with residents on a daily basis. But in the last like couple of years where I was, it was mind blowing. Like there would be students, residents tell attendings that they were going home. Like, oh, sorry, I can't check on that. You know, like I'm too busy. Like maybe we can check on that tomorrow or just not even answer, like ghosting your attending.
That happened to you?
Not to me.
I was going to say,
not that I can recall because I would have probably freaked out.
Maybe that's what they're saying. Like, no, like they don't do that with me. That's, I don't know, you know,
that's a good thing that you have that, you command that respect, but I feel like you probably do that without being a bitch. And that's like the fine line that it's hard to,
depends on if you ask my ex-husband that or not, he might say the latter.
No. Right. But it's a fine line. Like you want to be able to have your respect and, you know, be a well-respected female in the medical field, but you don't want to be a pushover. You know,
Correct.
like you don't want to be a bitch. You don't want to be a pushover. You got to be somewhere in that middle ground. And so often I see people really on one side or the other, and it's a little frustrating.
It's tough. I mean, but like I said earlier, you know, not everybody's going to like you. And that's usually their own problems and their own insecurity and has nothing at all to do with you as a person, right? So I think about the people that don't like me very much. They probably have their own internal reasons for not liking me. The practice isn't good, or they don't get referred business, or, you know, they're at the hospital till 2:00 in the morning and I'm rolling out at, 3 in the afternoon going home. I mean, that's their problem. That's not my problem.
Right.
And, I teach my son the same thing. I said, I tell him, he's half Spanish. I go, Papi, you can't control what, people say to you. You can only control your response to them. You can't control their lives. You can't control their happiness. You can only control how you treat people and your response to those people.
Right.
Yeah.
Right. I love it. That's so good. I love that. So how was it being a parent and having this role and co-parenting, because you said you have an ex-husband. So how was that?
Difficult. It was a tumultuous event in my life. I was the party who wanted it. The other party did not. So the co-parenting is not really existent. It's kind of he's here or there, and it's kind of in between. But I mean, being a mom is my most favorite thing in the entire world. Also, the most difficult job in the entire world.
Yeah,
hands down, the most difficult job. Like everything's going fine, and then we're having a meltdown. Why are we having a meltdown? Like we're having a meltdown over math homework. I don't know why we're melting down over this. You know? And I'm like, it's fine. He's like, it's not fine. They didn't teach me this at school. Why are we doing it at homework? And there's tears, and I'm like, oh God, this is fourth grade. Great.
Yeah.
But
that's gonna be Charlie for sure.
I love having a son. I love being a mom. You know, my husband and I, we take him as many places as we can, and you know, culture. We're going to Japan next year. Just he's like a little person now. You know, like a little personality, and it's very, very, very fun.
That's awesome. Yeah. That's awesome. What do you tell other women who are going into medicine about having kids? I get that question a lot.
Do you?
As a surgeon, it's, you know, very controversial whether you should have kids or when you should have kids to this day, which you would think it shouldn't be in 2023. But I tell them to just have them whenever you want to have a kid. You know, like, don't leave it up to anyone else
100%.
Because just like how you can't control what they say to you and why they say things to you, it doesn't matter. They're not going to be there for you. Like these people who are telling you, oh, you need to wait until you're not an intern, or you need to wait until you are in fellowship. Like all of those rules and guidelines are bullshit, because it's your life. It's your fertility, it's your family, and you have to do what's right for you.
I totally agree. I don't, I think people should look, if you're waiting for the right time to have a kid, you're going to be waiting forever. There's no right time to have a kid, right? Internship's rough. Then residency, you're trying to get a job, and then fellowship, you're trying to get another job, and you want to be the best, and you want to do the research because you want to get a different fellowship. There's no good time to have a kid. I mean, if we haven't figured that out by now, I mean, there's just not.
Right.
I had Harrison when I was in fellowship, and I used it to my advantage because I'm like, oh, look, I'm pregnant. Can't go in the cath lab.
Yeah.
You know, I'm like, can't have the radiation. And then by the time I could go, there was already a second year who really wanted to be in the cath lab. So then I really didn't have to go in the cath lab. So, no, I think the biggest thing is, and rightfully so, I think what goes through a lot of people's heads, men and women, especially in training, is, oh my gosh, someone's pregnant. What am I going to have to do now? Like you have to make up for that person when they're not there. Mm-hmm. And I understand that to some extent, you know, like they're not having the kid. Why should they have to take on the responsibility of the person who is having the child? And I understand that. So I think have a child whenever you want to have a child, but be prepared to have to kind of make up for it, you know, and to kind of not put too much burden on your colleagues that are going to be there to kind of help whenever you're having your child.
Right. And like, be mindful during the whole pregnancy.
Correct.
I think that's super important. Like, especially when it's your first kid, like you're on high alarm about everything. And so you think like a little cramp means you're going into labor, and you like, you know, sound the alarm and freak everyone out. But then you put into motion this spiral that's going to like cause, call shift changes and things like that. And it's like, okay, take a deep breath, see what's really going on before you sound the alarm, and make sure that you're doing what you need to do when you're supposed to be doing it, and find the coverage when you need the coverage.
Right.
Like, you know,
I'm very, very, very close with the physician who trained me. He was my program director in cardiology, and he always jokingly said that I am the most manly fellow he has, and I was the only girl, because I was like, I was really tough. Like I was tough because again, I kind of had to like feel like I was proving myself, because there's not a lot of female cardiologists. So couldn't get pregnant. He comes over to me and he goes, well, you can't get pregnant because you have testicles where your ovaries should be. Tiffany.
Oh my God.
And he, if you knew him, he meant it in the most like loving way in the world. Cause he's trying to tell me like, these people aren't shit compared to you, you know? So then when I got pregnant, he was putting things up in my locker, pictures of ovaries and all this stuff. It was hysterical. But I shouldn't say the first. My ex-husband was the first. He was the second person besides my husband to hold my child.
Oh
like
my
he
gosh.
was like right there as soon as it delivered, like, give him like I had a great fellowship. I really did.
Yeah.
But again, I didn't really rely on somebody else to pick up my slack. I had zero desire to go into labor. I had a scheduled C-section.
Yeah. Oh my God. Amazing. They let you do that
Yep.
in your first baby.
Yep.
I did that on my second baby. I was like, you know what? We're just going to schedule this.
Yes. The OBGYN who also worked at the hospital, who I was very, very close and friendly with, I told her, I said, listen, if I'm texting you, just text back. If I'm calling you, start driving. Because that means that I felt a contraction. I never felt one single solitary contraction.
Oh my God.
I had it scheduled. The whole, I mean, I had to go into L&D a few times just to get IV fluids because I was working so hard. I didn't drink. I wasn't peeing. So I don't know. Pregnancy was very bizarre for me. I truthfully, and I know I'm probably I hated being pregnant.
No, there's a lot of people like that.
I hated it. I love my son more than anything in the world, and I would do it again to have him.
Yeah.
I hated it.
Yeah.
I felt huge. I couldn't breathe. Nothing fit. I was grumpy. My face was breaking out. Oh God, I hated it.
Yeah.
I hated it so much.
My first wasn't as bad as the second because the second I was older. So it was like, oh my God, we're doing this again. Like, I'm stretching again. Like, the heaviness, the swelling. Like, I actually had really clear skin with Cam, which was amazing, but it's a lot. It's a lot. It's a lot on anyone, much less someone who's working like a crazy high intensity job.
But pregnancy is a disease state. People forget that.
What?
Yes.
Tell me more about this.
Well, all of your hemodynamics completely change,
This
right?
is
I mean,
true.
you're holding more fluid, your blood pressure goes up. I mean, pregnancy itself is a form of a disease state. So you have one problem. It's probably going to get worse if you get pregnant. You have high blood pressure, gets worse. Diabetes gets worse. Certain cardiac conditions can't even get pregnant. Pulmonary hypertension, worse. So, a lot of people forget that, and then what happens is you've got these very oddly holistic OBs that are like, oh, you can just eat whatever you want and you're fine. And my OB was like, honey, you are a reflection of me. You are to gain 26 pounds.
Yeah.
Not 27, not 28.
This is amazing.
26. Yeah,
I've never heard an OB say this, but this is amazing advice.
She's like, I don't need you gaining 40 pounds. I'm your OB. This is a reflection of me. She was really funny, but she's right. And so I gained probably the 2 weeks before I delivered, it was all just water weight.
Yeah.
But I lost every pound of my baby weight by 8 weeks after delivery. Because it was all, I didn't eat for two. What is that? That's not a thing. There's not two people. That's a 6-pound baby inside of you and a whole bunch of fluid. Why are you eating for two?
Yeah.
You need to eat as much as what you would feed your dog extra. That's how much extra food.
Not
that's
even
the
that
weight.
much.
I don't understand that. I really don't.
I know. I pause because I don't want to like offend people when they tell me they've gained 80 and 90 pounds with a pregnancy, but it's like, who told you that was a good idea? Like, that's a horrible idea.
Well, yeah, I mean, it's
just, I'm sorry, but it's very gluttonous.
Yeah, and I don't think it's offensive to recognize that it's not appropriate, right?
Yeah.
It happened to someone, and now we have to, as physicians, help them to realize that wasn't appropriate and help get the weight off, right? That's where we come in. But for anyone to think that it's appropriate for anybody to gain 50 pounds in 9 months, I don't care if you're pregnant or not, that's not appropriate.
Yeah.
So it goes right back to the weight problem all over again. And it's not about, listen, a lot of my patients are overweight. I'm a cardiologist. That's what I do. And I do weight loss, but it's our job to educate and help them get the weight off so it doesn't happen again and go through all the risk factors and not tiptoe around the subject. Mm-hmm. Tiptoeing is what causes the problem to begin with.
Right. I love this. Yeah. This is so good.
This is not, I'm a little diabetic. No, you are diabetic. That's like saying you're a little pregnant. No, you're pregnant. There's no little pregnancy. Like you are or you're not. There's kind of no in between.
So you do a lot of educating like through social media. How do you balance all that? Because I feel like for me, I have to have this like social media like on button and I have to be able to perform and act and do all the things and like, have this persona. But I'm also a real human and I'm a doctor and I'm a mom, like, and a wife, like all these things. Like, is it easy for you to do social media and to create your content?
Oh, I don't think I do nearly as much as what a lot of my colleagues do.
Well, I think there's people who are taking it overboard and are ridiculous with it. But
I do it only when I have time to do it. If there's downtime in my office, and mine, if you haven't figured out by now, is usually it's educational, but it's funny.
Yeah.
And it's like an outlet for me. And that's when I do it. But I don't have time scheduled in my calendar, except for this, because you're lucky. But I don't schedule time in my calendar to do videos. A friend of mine who's a GYN, like out west, she's like, oh, it's a day in the life of me or whatever. And it's like, oh, I sit down and I've got this hour typed out for me. I'm like, oh, I don't have time to do that. And truthfully, I don't want to take an hour of my free time to do that. I want to go spend time with my husband and my kid. I don't really, so for me, it's, if I'm at home and like my husband or my son are already doing something and I'm not involved in it, right? Maybe I'll take a few minutes and do something. Or if someone cancels an office spot and I have an extra 20 minutes to sit down and do something, I usually save it as a draft and kind of type it up later. But I'm not, And
it just comes to you. So you're not like out here, creating a content calendar and God, people do this. It's like a full-time job.
Yeah, no, I don't have time for that. I mean,
I think it's just so bizarre how some people have taken medicine by becoming like a med influencer, and like that's their identity. No, let's get started about it. I want to talk about it because it's so annoying to me. Like, I feel like you and I both kind of jumped on social media around the same time because I feel like we've been Instagram friends forever. And we both like post things and we're very realistic and people can connect with us, but we're not like dancing on TikTok and like, you know, putting on a new pair of figs every week just to promote them.
Okay. So I love it. So I turned to my husband the other day. I said, I don't understand. And the amount of time that this person took to make this reel to get a free pair of scrubs, they could have worked and bought 10 pairs.
Yeah.
I don't understand the fascination with being, I mean, listen, if a company were to say to me, hey, you already wear my stuff in a video that you're going to post anyway, can you tag us? Okay. Right. Yeah. But I'm not going to go create a video for another company that's not paying me. No, I got shit to do.
Yeah.
A lot of shit to do.
Right.
And so my quote that I tell people, if it doesn't make you happy, make you healthy, or make you money, it is a waste of your time. So that shit's a waste of my time. It's a waste of my time. Right?
It is.
So me doing my own little reels, my funny stuff, honestly, it makes me happy. I like to do it. And it helps my patients to be more healthy or to have more knowledge about things in cardiology that people don't have knowledge about. And I carve out time out of my calendar to exercise. I don't like to exercise, but I carve time out to exercise, right?
That's important.
And everything else it's got to make me happy. I mean, that's it. So I work in my calendar, I work out, and the rest of the time is my happy time with my family. I don't get this whole influencer thing. I never have, I never will. I don't get it. I don't get it.
It's really weird. It's really freaking weird. And then what's even more crazy is like when you meet these people in person, they can't even like make eye contact with you.
Well,
like they are so into their phones and like the algorithm and posting and hashtags and like AI at this point, you know, like all this crazy shit that it's like, are you a human? Like, can you talk? Can you complete a sentence?
One of these influencers, and I don't want to say too much, but one of these influencers was one of my trainees, right? And I see this stuff and I'm like, you know, when you look and you're like, but you weren't even that good, you know?
Right. Like, so why are you dancing like that?
It's an attention thing. It's very bizarre to me. It's like, where are you not getting attention in your personal life that you feel like you need all of this attention from a whole bunch of randos?
Well, and also the downsides of social media. Like you post all this stuff, you get a little bit of traction, and then you're going to have all these haters. It's very like unnerving for me because I'm like, I didn't post this for you. So why are you commenting? Like, I don't care what you're saying right now. Like, I block people all the time.
Same. A person who doesn't like you but watches everything you do is still a fan.
Yeah. I know. It's really freaking weird.
Yeah, I don't know. But you know, and again, it's not funny. I'm not a hater. Like, go do you. I don't care. It's just I don't get it. I don't understand it philosophically. I don't understand. Like for me, it's just.
I think for some of them, it's like a narcissistic thing as well. Like they really feel that they are that important, that they are famous on the internet. And it's like, okay, you're not. Like, no one knows you.
So I'll tell you a funny story. So I'm in Boca Raton. I'm shopping. And I'm at the, now I'm going to be the bougie side of me, but I'm at the Chanel boutique. I'm shopping and I wanted a new handbag.
Yes.
So I'm shopping.
We all want them.
And I'm with my husband who could give 2 flying Fs about social media, Instagram, doesn't give a shit about anything. Right?
Yeah.
And even though he does media work, like big news media work, he doesn't care about social media. So I'm in there and this person comes up to me and says, oh my God, you're Dr. Tiffany. My husband's like, yeah, because it was like, you know, and I was like, yeah. I said, are you one of my patients? And she's like, no, I follow you on Instagram.
Yeah.
This was the most bizarre moment of my entire life. Okay.
Yeah.
I've done national news. I'm a spokesperson for a supplement company, which by the way pays me. Right.
Right.
So, and I believe in them. And so I'm literally on TV every single day. No, it wasn't TV. She follows me on Instagram. My husband said, what the has the world come to? That this woman recognizes you in the Chanel boutique from Instagram. I don't know, but whatever. Hi.
It's a weird world that we live in.
It was so bizarre because I'm like a nobody on social media in my, in my head. And to think that but at the same time, because I'm not an influencer, quote unquote, right? And I just do my own content. I'm like, oh, maybe something I said like sunk in and maybe someone listened and maybe, so. Right. You never know. I'm
all about the authentic content. You know, like if you're putting out good stuff, then do it and keep doing it. But it's like, if you're literally just like dancing to some little jingle for some free scrubs. Like, you need to stop. No one thinks it's cute.
I'm dead.
No one thinks it's cute.
So
Like, I have a couple friends and we just like send them back and forth to each other. And we're like, what does medicine come to? This is what we're doing.
Yeah. My favorite reels are usually like moms, the mom reels, like when they're trying to like, you know, I don't know, or like something that the kid said that was funny and like repeated it at school. I mean, there's some really funny mom people out there. Like, some really
There's one
funny
that's like something like
content.
Adulting, like a current adulting or something. It's like hilarious. Yeah. Like she says everything we think. Love it.
Yeah.
Those are the good things of social media.
I mean, that's, I spend my downtime, you know, when I'm scrolling on Instagram, it's just, you know, I've learned to communicate with my friends via reels. Like they send one, I send one, they send one, I send one.
Exactly. I know I sent so many today. I felt like the internet was winning today. Okay. But so speaking of reels, you had a reel recently where you said you thought lip injections were, what'd you say? They looked horrible.
I think I said I'm not a fan. Let me look here.
Okay, so have you done anything on your face? And you don't have to tell us that, but
I think lip injections look ridiculous. Oh, that's a fact. I do think they look ridiculous. I do Botox.
Okay.
And I've done Botox since I was 26.
Okay.
Because I think it's preventative.
It is preventative.
Yes.
Preventive. Okay, so like the other day we were at a little networking thing and somebody was like, "Oh yeah, I work out and I eat healthy." And I was like, yeah, you just need add a little Botox into that. And you got the trifecta. And they thought I was like Satan.
So rude.
Yes. I was like, come on. Like it was a joke.
Well, I as you can see, I'm a lot of facial expressions when I talk, a lot.
Yeah, but you don't have resting lines. So the Botox is working.
Right. So I raise my eyebrows a lot. I smile a lot. And so I tend to get a lot of wrinkles around my eyes and my forehead. I don't have crow's feet though, because I can't even like make that face if I want. I don't know. But that I do pretty religiously. I go like every 3-4 months.
Yeah.
Because I'm like a hyper metabolizer, so it's like really should be every 6 weeks. But no, that's it. But maybe it's because I was blessed with good lips that I
was going to say, I almost commented, that's because you already have good lips. Like people with really thin lips, like they need a little help once in a while.
That's fine. But like, let me ask you a question now as a surgeon, as a plastic surgeon, why do they do so much that it's like, it goes beyond the vermilion border and like the between their nose and their lip is puffy?
So
can we talk about that? Because that looks ridiculous.
That is, I agree
when the profile,
with you. Yeah,
like the
when they have a monkey lip,
when the skin color of your face looks puffy. Right. It's weird.
Yeah, it is weird,
and no one like knows how to do it where that doesn't. I don't understand. What are they doing wrong? Please tell.
Well, there's a couple things. So first of all, the patient probably got injected too many times. So that doesn't happen with one series or one round of being injected. Like it's not one syringe of filler that's causing all of that. But it's what's happening is that people, they're getting their lips done. They're liking how they look swollen. The swelling is going down and they're like, oh, I need more. Let me go get more. Maybe their injector is doing more, which can or can't be appropriate depending on the anatomy of the patient. But maybe this person even just doesn't listen to their injector and goes somewhere else and goes again and again and again. And it's overfilling of the lips that ends up causing that like migration or it's bad technique from the start. Yeah. So like if they're just totally injecting haphazardly, they don't have good training, they're just not talented in this area because not everyone can do injections. Like facial injections is like sculpting. Like, I'm putting product in different planes of the face. Like, that's not for everybody.
And you can mess something up.
You can mess something. You can cause occlusions. Yes. You can cause facial necrosis. There are big problems that can happen. So you don't want to just go to anybody. You don't want to go to someone who's going to tell you yes every single time you walk in the door. Like I have many patients who have been my patients for years at this point. Years and years that I've been injecting them. And they'll come in almost every single time. I want my lips done today. And I'm like, no, I'm not doing your lips today. You'll look ridiculous. And I'm not going to have you walking around telling people that I inject you when you look like that.
Like my GYN said, yes. I don't want your reflection of me.
Exactly. So, if somebody has really small lips, they have to start small too. Like you can't go with thin paper lips and expect to get lips like yours or lips like mine. It doesn't work that way. Like you've got to build up slowly, very precisely and meticulously to get to your goal. And you may never get to your goal depending on how your anatomy really is.
My husband's so funny. He's like, I don't get it. I don't get why women do this to their lips. He's like, when's the last time in a guy chat that we ever sent photos like, dude, check out her lips? He's like, no, it's tits and ass. That's all we care about. He's like, no, he's like, who are they? I was like, maybe they're doing it for themselves. He's like, it's dumb. They need to stop.
The over injection does need to stop. Yeah. I agree.
It's a lot. And then
it's very rampant here.
I saw a woman the other day at freaking Tropical Smoothie. Okay. Homegirl's just trying to get a wrap. That's all I'm in there. Right. I'm in there. I coach my son's baseball team. I'm just trying to get a wrap and a smoothie. That's it.
Yeah.
And this woman, it looked like what would have been a meme on Instagram as a joke, but it was real.
In real life.
It was unbelievable. Yeah. I mean, it looked like the diameter of like this pen, like in her face.
Yeah.
And it probably stuck out 0.5 centimeter from profile. And it was, I feel bad. I don't know who's telling these people that. I mean, they look like I don't know, like
I said, they're getting bad advice. Ugh. They're going to bad injectors.
Well, someone is just taking their money.
They're just taking their money, 100%. Like,
awful.
That's the kind of world we live in.
Well,
it's reality.
Anyway.
But subtle, very conservative lip injections can look nice. A lip flip can be nice.
This is, I'm a fan of this.
Have you ever done that?
No, I have not done it.
You don't really need it, but I want to tell you to try it.
Okay, did we just talk about this? But a friend of mine had it done. Well, it's a friend of a friend, went to dinner for a friend's birthday. And she's like, oh my God, just do a lip flip. And she's like, that's what I did. Your lips look fantastic. That looks so much more natural.
It does. It usually does.
It looks so much more natural.
Again, it's got to be the right anatomy. But in a lip flip or a variation of it can also help with a gummy smile. So people who like smile and you see their gums, like it's like horse mouth situation, that can be fixed. It can be fixed and it can look really nice.
I'm a fan of this.
Yeah. Okay. Okay. So Tiffany is not opposed to everything.
I'm not that much of a brat. No.
I know. Okay. Well, is there anything else that you want to tell our listeners about cardiology, about being in medicine, about being a woman, a mom, anything?
I think just generally, I tell people, just make sure you like your doctor. You can be honest with your doctor. If you don't like your doctor, find a new one. I find that the majority of second opinions I get, the doctor did nothing wrong. It's just they didn't like their doctor. Their doctor didn't communicate with them. And then that's where you lose trust, right? And so one thing about me, and I've been like this my entire life, if I say something, it's the truth. It's how I feel. And you can, I tell people, don't worry until I tell you it's time to worry, right? That's like a saying in my office because they come into a cardiologist thinking they're dying.
Yeah.
Right? It's not like, oh, I really just want to look better. Like they think they're dying when they come in. And so I think that's my big, I'd really, for the general public, like pick a doctor you like, pick a doctor you can communicate with, even if you have to pay for that, to kind of have your best health. Because if you think that you're just going to go through your insurance, find a doctor, and they're really going to cover everything from head to toe and be preventative, it's not going to happen.
It's not going to happen. Yeah. A lot of the second opinions that I get or secondary consults are from people who went somewhere else and the doctor just didn't even listen to them. Yeah. The surgeon was like, this is what you need. This is what we're going to do. Not what would you like to see?
Right.
What is your goal? What is the outcome you're looking for?
And you're the expert, right? And so, if I were going to come to you and I want some sort of procedure done, I'm going to say, this is what I'm thinking would look good on me. Mm-hmm. This is what I would like. And then I'm going to lean on you to say, probably not.
Exactly.
Or we should do this instead or whatever. And I think a lot of people just it's kind of like, back in the day when you used to take a picture of like a haircut and go in and be like, I want this. It's like, yeah, but you don't have thick hair. It's not going to look like that.
Right.
Nope. They'd cut the damn hair anyways. And it looked like you were wearing like a mop on your head, and because that's the expert. Right. And so, I think, just as a hairstylist is an expert in cutting hair, you're an expert in surgery and I'm an expert in cardiology. Like you have to trust the person you're seeing. Or else what's the point of going to them?
Right. Why are you seeing
Why
them?
are you coming? Why are you paying me for my opinion if you're not going to listen to me, right?
Yeah.
But you're not going to listen if you don't trust them.
Right.
And you don't trust them if they don't listen to you. So
exactly.
Yeah.
Love it. Okay. So how can people find you? How can they connect with you? And or how do you want people to reach out if they're interested in becoming a patient?
Oh, okay. Good question. So I guess my Instagram, since we've talked so much about that today, I had to look it up because I'm really bad. It's
I know. I was like, is it doctor?
So it's at Dr. but Dr. Tiffany. Spelled the normal way, not with an I, not with an IE. Tiffany Di Pietro, Dipietro. That is Facebook as well, but I don't really use a lot of Facebook. And then my office, the easiest way is just emailing us. We usually do a lot via email, and it's Concierge Consultants with an S at the end, Concierge Consultants, FL like Florida, @gmail.com.
Okay. Amazing. Do you open your DMs?
Yes.
I do too.
Yeah.
I respond to every single one.
Do you?
Yeah.
I respond to most.
Yeah.
Yeah.
Most people, or a lot of people don't anymore. And it's weird. It's like, well, why? Then why do you have that account?
I get some creepers sometimes from my commercials and stuff. That's always fun. Yeah. So then I just forward those to my husband and let him respond.
Oh my God. Love it. Well, this has been an amazing hour. Thank you so much for driving, for coming here, for being with me, for having candid conversations. Like a lot of what we said, people need to hear. And I appreciate the realness. So thanks again. And everyone, please follow Tiffany, reach out if you have any questions.
Thanks for having me.
Bye.